Hey, I'd like to show you a really kind of minor, moderate orthodontic correction that has a true functional benefit. And I will confide that orthodontics, unlike most specialties and areas of dentistry, which eliminate disease, is not really eliminating disease. A lot of what we do will be cosmetic in nature. There are certain cases that we do to make somebody more comfortable or to improve a TMJ joint or to get better jaw balance or make teeth easier to keep clean. So that's true. But a lot of what we do is cosmetic. But I'm going to show you a true functional benefit to a minor treatment. If you look at the patient, on the left is how the patient started. The upper teeth are in reasonable alignment right at the outset of the treatment. The lower teeth, however, are fairly crowded. Now, this will not cause gum problems if a patient brushes well. And, I think most people can be trained to work hard to keep this clean. It's certainly easier to keep aligned teeth cleaner. But that's not where I'm going with this. If you notice, this is a young woman and she's got, well, you don't notice that, but I'm telling you it's a young woman, but you'll notice that there is wear on the incisal edges of the lower anteriors and definitely wear on the upper anteriors. And this is related to the way the patient is biting. Dentists will recognize this is a class 1 bilaterally, but the upper teeth are pushing against the lowers, and the lowers are responding by crowding. And this is a very kind of tight occlusion, close to edge to edge. So what we did was we set out to line up the teeth. Now, the cosmetic benefit of this treatment, if you look start to finish, is moderate, well, certainly substantial with the lower alignment. You see how much straighter the lower teeth got, and this is not perfect yet, but another 9 more aligners will get it there. The upper teeth, cosmetically, are in a little bit of a fuller, broader arc, a little rounder, but look at the clearance we now have between the upper and the lower teeth that we didn't have before. And this will minimize wear. It will not eliminate wear, but when the patient is chewing or going into excursions of the lower jaw, either during function or parafunction, outside normal function, where they may be clenching or grinding, the teeth that are womped on top of each other like this are going to bear the brunt. And the teeth that have a little bit of a clearance like this will be a little bit more protected. So this is just a lot of patients as they age get an inward migration of the teeth. And as the teeth move inward, it can lead to more wear. And I also will point out that I have found a correlation, given that the patient's lower teeth were so pushed back. It tells me that they are sort of fighting, and the lower jaw is almost being held back, and the lower teeth are leaning back. I think a lot of people who have TMJ soreness, something like this can exacerbate something that might be pre-existing. Notice I didn't say cause, because there are people with TMJ problems with perfect bites, and there are people with terrible bites and no TMJ problems. But there is a correlation, in my opinion, between upper teeth that are contacting tightly against lower teeth that are retroclined like this. So I thought this would be helpful to show.